Can you share a memorable moment from your involvement with this program?
I think meeting with Ansela and Luke and really seeing how they took the idea of doing this seriously and have been very helpful in guiding us and being open about what the process is and not willing to give up. That if we tried something to get funding here and that didn't work, then they brought us something else that we could go after. We're grateful for their support and their expertise in doing this.
How can the community and the local government better support projects like this?
First of all, they have to give financial support, whether it's from the government, their staff, or helping us to get the state or the federal government down here and to bring in the staff that we need.
What was your experience with the Emory study and what was the result?
UGA and Emory had a couple small grants and they asked us what to do with them that would be impactful for the community. We suggested doing a different kind of health fair that allowed to get information from the community as well as us giving out information. We did a number of different stations so that we gave out information in bits and pieces instead of like a fire hose, and people could grasp it. But we also talked to them and got information back from them. They really talked about being concerned about being contaminated themselves. We all, like I said earlier, we all grew up with that. And so when we looked at the data from the health study, and everybody was like really wanting to know about if they were exposed or not, that's what led to the Emory saying, well, let's try to do a pilot study. So, and yes, I participated in it because I grew up 1 block away from Hercules, toxaphene making plant. And the results are I have toxaphene in me. Now, I've never worked at Hercules, but I also have, so I have 2.5 times the levels that I'm supposed to have. Well, actually not supposed to have it in my body at all. And then also PCPs were made at the LCP site. And now I've never lived over there, never worked over there, but I have it, again, at a very high unhealthy amount in my system. We finally have proof that these chemicals are in people's bodies here, because I'm the walking proof.
What do you hope to see as a long-term outcome of these kinds of community engagement projects?
Well, what I hope is that we can better educate ourselves in the Black and brown communities about the harmful impacts of these chemicals and these toxins. But what we really want is to have the best health care in the world based here. A lot of folk go to the Mayo Clinic in Florida, but they go up to Emory University. And they have to travel and they have to stay somewhere, especially if a family member have to take you. And that is a tremendous burden on families, especially in a place like Brunswick, where the median income is between $23,000 and $33,000 a year. So we really technically can't afford treatment. So what I would like to see is for us to have those expertise in healthcare here, treating kidney diseases, heart and lung issues, and that's what I really want to see long term.